West Michigan, we have so many awesome places that care for our children, including the Helen DeVos Children's Hospital in a very special area here. Where are we at?
We're at the Helen DeVos Children's Hospital Pediatric Orthopedic Clinic.
And what's your job here?
I am one of the pediatric orthopedic surgeons that takes care of children here in West Michigan.
That is awesome. You know, what actually happens here at this clinic?
This clinic is both a general orthopedic clinic where we see kids with a variety of orthopedic conditions, but we also have a special, what we call a fracture clinic. Kids are active, and and that's what we want them to be, and that's what we want to return them back to be. Kids being kids, but fall from playground equipment, very common in the summer. But also during the winter, and once skiing, snowboarding, falling on ice. Simple darn rotten luck is what I used to say. I like to say.
I like it because you really are all about kids and families here, aren't you?
Absolutely.
Everything's kid-friendly, the whole experience.
And that's one thing. It's when you're injured, once you're already grumpy, and if you're a kid, think about that. It's ruined your day. But not only that, but now you're going to the doctor's office. You always get shots at the doctor's office. So it's not the greatest, you have it in your mind that it's not the greatest place. But here we make it so it's as friendly as possible, as easy as possible to get care. And so from the nice, happy colors, the pictures, but the staff is just fantastic. And they're very happy. They love children, all specially trained in pediatric orthopedics. So from the very beginning, from the check-in to the check-out, it's all bent on the kids and their treatment and making it easy on them as possible.
Well, we have 4-year-old Paxton who is helping us through the journey. And tell me what you're going to do for Paxton, and that's something you do for kids you treat.
So most of them are treated with casts. And the way we put a cast on is a variety of different ways, but we usually choose a liner, either that be a non-waterproof or a waterproof liner. And once we have that on, that protects the skin from the cast itself. And then we'll actually put the cast on.
They seem a lot lighter than they were in the old days.
They are.
Plus, kids get to choose colors.
They do, and we have a variety. We have a color chart that we use, and 12 different.
What's the most popular color?
For girls, it tends to be pink or purple, but not exclusive. And boys tend to choose blue, green, and we'll fancy it up a little bit. Sometimes we'll add sparkles if you like it.
Wow.
Add stripes. So green and white is very common. I prefer maize and blue. But it's quite, if you're going to have a cast, you might as well make it your own.
If a fracture or break isn't completely obvious, what are some of the things parents should be watching for?
Sure. Young kids especially, it's like a lion with a hurt paw. They will guard it. And parents especially, are very attuned to the normal children's behaviors, and so it's, listen to the parents because they know their kids the best. Things that you may watch, it might not be so obvious. If they're not walking, that's very important. There's something called a toddler's fracture, a fracture of the leg, that may not be obvious, but if they don't put weight on it, chances are it's probably broken.
Well, if a parent is suspecting some of this, do we need to call the pediatrician? Do we go to the ER? Or can we just stop by?
Yeah, the nice thing about the fracture clinic is that there's no referral needed. The parents can, if you believe your child has been injured, you can, and suffering from a fracture, bring them to the fracture clinic, and we can evaluate them with our pediatric orthopedic specialist that can give them comprehensive and specialized care to be able to treat it without the need for a trip to the urgent care.
We love everything that's happening here. Thank you for keeping our kids healthy and getting them better when they need you.